So good afternoon, everyone. We have an opportunity today to talk with Dr. David Weissmantel, who is the university physician and who has been leading us through so much of what we've been experiencing since March of this year. He's been critical in keeping us updated and providing information that allows us to be in the best position to mitigate the spread of the coronavirus. So today there are some myths that are hanging out there, and we just want to spend a little time debunking those myths and providing you with accurate information. So Dr. Weissmantel and I are going to have a little conversation. We're going to just go back and forth and see if we can't answer some questions. You ready, Dr. Weissmantel?
Still ready.
Okay. All right. So I'm going to start with a public health related question. So the public health process of contact tracing is associated in the minds of many with processes for STDs and other sexually transmissible diseases. As a result, people are associating stigma with that process. Can you address these concerns and help to dispel some of those concerns associated with contact tracing for what we know is a respiratory illness when we talk about the coronavirus?
Sure, I'll give it a try. So just first at MSU, what we do is we will often know at the same time or several hours to a day or two before the county health department does of a positive COVID-19 test. So we are doing our best to begin the contact tracing as soon as possible to help keep our community safe. So that being said, the contact tracing actual procedure is we contact the person who is the positive case and ask them some very specific questions about a very specific period of time. And that period of time is 2 days before they develop symptoms to the current time, to look back and let us know any people that they spent that famed 15 minutes within 6 feet of, and especially without masks. And it's really just that simple. We'll walk them through day by day as best as we can, especially if it's 2 or 3 days. If it's 5 or 6 or 7 days, it gets really difficult for people to remember that. And then we'll help them with some questions. Any meals that you had on any specific days with other people, people that you live with, people that have come and visited, and just some very basic questions about really general social interactions that we all have every day. And really the questions are not intimate in any way. It's just who visited and what were those circumstances like. And the smaller the time frame, that's why it's really good that testing be done quickly, because it's easier for people to remember a day or two versus 5 or 6 or 7 days of time. We ask them if they say, yeah, there are these people that I did spend that time with. There were 5 people over. We spent a few hours together, and we gather names and phone numbers of those people and anybody else. And then those people are reached out to by my office and the Office of the University Physician, and often by the county health department. But when they are contacted, they are just informed that they have been identified as a close contact of somebody that's been diagnosed with COVID-19. Who that person is not told to that close contact. I can't say, of course, that if there were a get-together, it might become apparent to everybody that they were they were all together and they start talking. I was just identified as a close contact. However, if nobody says that they are the case, they will just all assume that somebody in there was, and that they are all spending time quarantined or in isolation. So that information about who that person is never told to the close contacts. So I guess I'll stop at that explanation of it. And the close contacts are then, of course, told. I think many of us have heard this, to quarantine for 14 days and monitor for symptoms.
Thank you, Dr. Weissmantel. And so in his inimitable way, he's answered the second question already. The second question was, what information is shared when a person is contacted by a public health official to inform them of their exposure? And so I appreciate that you were able to weave all of that together so that people understand what it is that's going on and what they will hear. I think a lot of the concern on the part of students has to do with, so they're going to tell who I am. They're going to say, Susie was, the person you were with, and then that's going to cause other kinds of concerns. And people then will treat me in a particular way because I exposed them to the coronavirus. But I again want to emphasize, and I'll give Dr. Weissmantel a chance to say something about this. We are talking about a respiratory illness. We are not talking about something that people then are saying, oh, you had such and such and such a thing. I know people are talking about COVID that way, but this is a respiratory illness. It's like telling somebody if asthma were, the thing that you could pass in that way. I have asthma. There's no stigma really associated with that. There could be concerns about you, but there's no stigma, social stigma associated with it. So Dr. Weissmantel, I don't know if you want to say something more about that.
A couple of things. I said that the person wouldn't be identified, and I will even go farther. Like when you're contacted, you're not told when or where that contact happened. You're just told you have been identified as a contact, and they will tell you, you're told how long you're going to need to stay in quarantine. So you're not given even that specific information about when or where. So, and then regarding, yes, it is a respiratory illness, and there should not be that stigma. And I will put a period on that and then say, though, we treat the information, as does the health department, as if it were sexually transmitted disease information, that we don't share it with others. We don't share it in inappropriate ways, and it's kept as confidential as that other information would be.
And that's a good thing. You want
that's a good thing.
Kept confidential. Okay. So the next question. The term we are hearing often is surveillance testing. Does this mean that once I have been tested, someone or some system will be watching me going forward, so I no longer have any privacy? Can you help us understand how this works and what surveillance testing is about?
Yeah, I think early on we were calling some of the things that we are piloting on campus and will be doing in the months to come surveillance testing. I believe that we have changed the name of that to Community Detection Program in order to help so that there is not this misunderstanding. So the Community Detection Program is some COVID-19 testing of larger groups of faculty, staff, and students in particular areas. Right now, there are pilot programs within the health colleges, the veterinary school, to just get the procedures down in those large groups. But in the coming weeks and months, there will be larger scale saliva-based testing of residence hall communities and possibly other congregate living settings in our communities, such as fraternities, sororities, perhaps apartment complexes and such. And initially, oftentimes when we say surveillance, that means we do not identify individuals. The particular surveillance that we're doing, the individual might, if they participate, might get a notification, an email saying that they have been identified as somebody who should seek further testing, which means that the initial testing said that there's a high likelihood that they are positive, but need to get an official test to confirm that. And everybody that would be in the surveillance otherwise would get an email, there is no need for you to seek further testing. But it is, and really what it's there for is so that we have an understanding of what the prevalence of the virus is in these larger settings. And it has the benefit of perhaps being able to find a few individuals that we can let know earlier, sooner rather than later, that they actually have the virus too. But we do not follow them after that in any way. It's actually opt-in, that you decide that you want to participate in this and nobody follows you afterward. And even if you say opt-in, if you don't put a sample in, you won't get a result back and nothing happens.
Once again, he's answered the next question.
Darn it.
I'm going to pose it and see if there's something more he'd like to add. But the last question that we were going to do in this segment has to do with the fact that there is a voluntary saliva test program underway. And we just wanted to know what happens in this process and why should students participate in this particular program?
Yeah.
So if there's anything additional.
Yeah, why we should all probably participate in that is that it picks out, it finds diagnoses of the virus sooner rather than later, lets us know where there may be problem spots that we need to address sooner rather than later before, 2 or 3 cases become 20 or 30 cases. That is the reason, and those are the kinds of programs that can keep the university open in a more full capacity or keep us at least at the level we're at. So that's the reason to participate. And you might get the benefit of finding out that you yourself have the virus and can address it sooner rather than later, not needing to wait for symptoms to develop.
Well, Dr. Weissmantel, we just want to thank you for taking the time in this short segment to share some critical information with us. We appreciate all the work that you're doing. We appreciate the way you have stayed the course in keeping us informed and making sure that we are doing the things we need to do at Michigan State University. So this has been just a brief conversation with the university physician, Dr. David Weissmantel, and we thank you.